Welcome back to Believers IAS Academy. In today's topic of the day discussion, we will be discussing about euthanasia, its legal stance in India, and also what are the different types of euthanasia. We will pretty much cover anything and everything with respect to euthanasia as a concept. And also in the end of the video, we will try and solve one prelims question as well. So let's begin today's video. So why are we discussing about euthanasia today? Because of the recent law which was passed in the United Kingdoms with respect to euthanasia, that passive euthanasia, or also we call it assisted suicide, which is been allowed. Now the UK government, the United Kingdom government is now passed law which allows passive euthanasia, restarting the debate on the right to die with dignity. Well, India already allows passive euthanasia, but in practice, it's still difficult to implement due to legal procedural hurdles. Because this is an obvious question: does India has euthanasia allowed, or do we practice euthanasia? The question is yes, India allows euthanasia, but in euthanasia we have two different types. One is the active euthanasia, another one is the passive euthanasia. We will see what active and passive euthanasia is a while later. But before that, let's try and understand what is euthanasia in simple terms. Euthanasia means mercy killing, or it's a way how to end a person's life, or even it is not just limited to person but also animal or any living being, right? It is the right, or it is a means to end the person's or an animal's life intentionally to reduce their suffering from a terminal or incurable diseases. So the condition is very clear: the euthanasia can be administered, or it is a means to kill a person, only under two important conditions. These two conditions must satisfy: that the person should have some terminal illness, or must definitely have a physical or mental disorder or mental illness, which is absolutely making the person's life or the living conditions more miserable, right? So euthanasia is that. So under euthanasia we have two different types. One is the active euthanasia, then we have is passive euthanasia. So what is active euthanasia? So active euthanasia is nothing but the direct way of or let's say lethal injections. This is one of the example of active euthanasia, where you're directly injecting a particular chemical to the person's body, for which the person immediately dies. Of course, even if we take example of active euthanasia worldwide, there are many countries which even till date active euthanasia is actually practiced. It is pretty much active, yeah. And one of the biggest example is Netherlands. In fact, Netherlands became the first country to make active euthanasia legal, right? And under active euthanasia, there are three different types. One is voluntary, where the person himself decides that the life can be ended. And another one is non-voluntary. Let's say his dependents or the doctor or the medical professional decides. And third is involuntary, which is absolutely illegal. However, in India's case, active euthanasia is considered as murder and can be charged under 302 of IPC, and also can be charged under 306 of IPC as abetment to suicide as well. So in India, active euthanasia is not practiced, but passive euthanasia is allowed, but on certain conditions. So what is the legal status of or let's say legal status of passive euthanasia in India then? So there are three important cases which we need to study, or which we need to keep in mind in terms of understanding this concept. So first is Aruna Shanbhog case 2011. Second is common cause, right? These are the two important cases or judgments we can call with respect to passive euthanasia. So one is Aruna Shanbhog case, where the very first time Supreme Court allowed the withdrawal of life support system. So now, what is passive euthanasia? So here we are not directly causing the death of a particular patient or a person who is having certain illness, right, by injecting him with some chemicals or lethal injection or that sort, but indirectly we are doing it, right? Indirectly we are doing, or how is the death being assisted indirectly by removing the support systems, the life support systems. So that way, even if it is assisted to some extent, the death occurs pretty much naturally, right? So it is highly debatable, but still this is what the definition is, which you have to know. Now, talking about the legal status, the Aruna Shanbhog case, it is the case of a medical nurse who almost lived more than 40 years. In fact, to be very specific, 42 years of her age in a vegetative state, as in completely inactive state. And in fact, that was the very first instance when Supreme Court allowed the usage of passive euthanasia, considering how severe and how difficult this case was. And the second instance was the common cause in the year 2018, where Supreme Court once again reiterated that the right to die with dignity is a part of Article 21, right? Right to life. And it also allowed that living wills, right? A person can write a living will stating that if in case I become unconscious, or let's say if in case I completely lose all my senses, or if I get something very severe, some illness, right? Maybe you can just remove me of all my life support systems, and probably in a way is giving his own will to assist passive euthanasia, is what we can call. So that is what was reinstated in the Common Cause 2018, where it allowed living wills, a written document saying when a person wants treatment to be stopped. So that is passive euthanasia, where the treatment is stopped for which the death occurs, right? And on the other hand, active euthanasia is when deliberately an injection or some chemical is ingested to the human body, which occurs the death, right? So there are two different aspects to it. So what were the Supreme Court guidelines? As in very recently 2023, it says that living will is allowed, but provided it has two witnesses and also needs a designated notary, right? And then two medical officers or two medical boards, not just officers, two medical boards must decide within 48 hours, confirming to the fact that the person is willing to be undergone the passive euthanasia. And also, if these two things are being refused, right, if the right to a person to die is not being guaranteed, or let's say is not allowed to undergo passive euthanasia, the appeal lies with the High Court, right? So this is with respect to the recent Supreme Court guidelines. So now, what are the global perspective with respect to passive euthanasia? As I said, it is legal in India, and considering how strict and how complicated the Indian democracy is, and how the legislation or how certain rules and laws are framed in India, considering if it is active or legal in India, it is definitely legal in many of the other countries as well. And in terms of active euthanasia, it is legal in few countries, especially Netherlands, Belgium. In fact, Netherlands was the very first country which implemented the active euthanasia way back in 2002 itself, and even Belgium also in the same year 2002. And but of course, there are few strict safeguards as well. For example, active euthanasia, for example, in Australia is under certain conditions, right? So these are a few things, because in Australia, when we talk, Australia as a country fully does not follow active euthanasia. Some states of Australia does follow active euthanasia. So that's what it means, right? And there's another interesting fact to this euthanasia as well. There is something called as euthanasia tourism, where people travel to countries like Switzerland to end life legally. So this is also another important, interesting, fascinating fact that you have to keep in mind, that in Switzerland there is a non-profit organization called as Dignitas. So this is an organization which aids, I can say, which aids assisted suicide to people. So people having terminal illness, having severe mental and physical problems, who feel like their life is so miserable that they have to die, they go to Switzerland, and this organization Dignitas, they charge, or let's say they assist suicide, or active euthanasia is what we can call it. So they ensure that the person dies with dignity. And in fact, this is also, it's a terminology, it's called as euthanasia tourism, right? So this is also one interesting fact, and of course, this is not for free. And this is also one thing which is very ironically, even to die, people are, like there's a charge associated with it. So that one service which Dignitas costs, based on Google and Wikipedia, it says it costs more than 7,000 US dollars, for that service. So it is a team of medical professionals, independent medical professionals, who administer this particular thing. So this is also one interesting fact that you can keep in mind, talking about the global perspective. Now, in the end conclusion, we have to understand that India has legally recognized the right to die by allowing passive euthanasia, but it must now make the system practical, because passive euthanasia is not bad all the time or in all instances. Passive euthanasia, to some extent, it is good, because see, there are many terminally ill patients who are literally like, or I shouldn't be using this word, but they feel that they are the burden to their families, right? And not just that, even if this is too controversial to acknowledge, but there are few patients who are just under the help of life, support systems, right? Who probably is brain dead. I think this is the most common terminology which most of the people have heard, brain dead, right? They absolutely do not respond to anything, and probably this brain dead or going for a coma stage for almost like 20-30 years. Obviously, considering the problem or considering the pain that the family has to go through, seeing their own son, their own daughter, or their own father or mother, being in that situation, in active state for almost like 20-30 years. Now there should be some guidelines which makes easier for these patients to ensure that they die with dignity, right? So that is what passive euthanasia, there has to be some clear practical system associated with it. So reforms should ensure in India concerning that no delays for terminally ill patients is taken care of, right? And also should make sure the misuse of this particular law is also not done, because see, let's say there are few patients who are just ill, and just because they are a burden to the family, it doesn't mean that they have I mean, the procedure with respect to passive euthanasia is so liberal that just because the person is ill, or just because the people in their old ages just become sick for some reason, maybe they could have been all fine, right? They can come back to their homes, but just because they are ill, and now just because the passive euthanasia rule is so light, now you're administering passive euthanasia to that person. So the misuse of the law is also something very important. So reforms should ensure to cover that aspect as well. And at the end of the day, respect for human dignity, both in life and death, is absolutely important. So hence, reforms should be made, and passive euthanasia as a concept should be made more practical, especially considering a country like India. So anyway, we will solve one prelims question and end the topic. So with reference to euthanasia in India, consider the following statements. Active euthanasia is legal in India under the Supreme Court's 2018 judgment. Passive euthanasia is allowed in India through the use of living wills or advance medical directives. The right to die with dignity has been recognized as a part of Article 21 of the Indian Constitution. Which of the statements given above is or correct? Anyway, that's all for this particular video. I hope you liked the video. Please do subscribe Believers IS YouTube channel for more such videos. Stay tuned. Signing off, this is Madan Gopal. Have a beautiful day.